And good morning. Good morning. It's time for CBD with your favorite PhD. Good morning, Dr. Kat. How are you doing?
I'm doing wonderful. Good morning, Carmen. Good morning, everybody.
Good morning. It's kind of a bittersweet. I didn't realize that this was going to be sort of, I knew that we're scheduled to do the end of the season, our first season with CBD with your favorite PhD. And it's just kind of this whole, wow, we got here so fast. It seems like we just started. And, we have a lot to cover, like really exciting things today. We want to highlight some of the past discussions that you and I have had and some of the questions that people have addressed with us. We also, from what I understand, you have some special offers for our viewers and our listeners. And you have some samples to give away, I think.
Yes.
Right?
Yes.
Okay, good.
Yes.
So let's
Discounts. It's holiday time, everybody.
Exactly.
What's better than getting us calm and happy than CBD without getting high? I think that's, the most wonderful gift you can give to yourself for the holiday time and to introduce it to family members who may be skeptical. So we've come such a long way this year. For me, it's been quite a joy meeting so many people, getting involved in so many events. This has opened so many opportunities, unexpected. We came together just to share, CBD and what we know as educators, clinicians, and therapists and consultants. So yes, hang on, you guys, because afterwards I'm going to share some products actually, because we didn't have a chance to do that this year. Just COVID and the fires and our immune health in our lungs took 3 episodes because the fires, you guys, 2020 August, I think it was the 17th, and it lasted all the way for over a month. People were very scared about their health. So, I'm going to go over some of the highlights, and these are available on our YouTube channels, and they're available on Facebook and live stream in case you want to dive deeper, because today it's just a review and a happy time and a giveaway. So, we talked about what CBD is. And as I mentioned, it doesn't make you high. We're talking about hemp CBD. We're speaking about cannabinoids. Cannabidiol is one of 144 cannabinoids compounds that are in this beautiful plant that is close to the poppy or the willow tree that gave us so much health benefits, and we haven't even scratched the surface. So I'm excited, as you are, Carmen, to be in the forefront of something that's been here for over thousands of years.
Right.
So,
and like you said, just really quickly, like plant medicine is nothing new. Right. And so we are focused on the hemp plant and the benefits of the CBD. But there's, as you mentioned in one of the episodes, there's so much more to the plant, but this is our main focus. So let's get started with the review. I can't wait to get to the products that you want to talk about and the special offer.
All right. Sounds good. And as always, this is over the counter. And so, no prescription needed, and you don't need to go to a dispensary. You come to your healthcare providers like us. We carry CBD, and we'll talk about that, later. So, one of the things that I want everybody to remember, the highlight, these are your questions, you guys. And one of the questions is, oh my God, what do I buy? So remember, third-party tested, full spectrum. If you're worried about getting tested broad spectrum, we're talking about, like you said, Carmen, the full plant. The other episodes that we covered that were really close to home, as I mentioned, were the immunity because of COVID. Now we're entering the winter season. You guys, come on, protect yourselves. This is so important. We know the CBD, CBD2, there's CBD1, which attaches to the brain and the spinal cord, and CBD2, which is for our immune system. It's in our lymph nodes. That's where most of it is held. And it makes our immune system, very happy. And so there's research going on right now. We don't know where it's going to go, but CBD and COVID, because we know inflammatory disease is in the lungs, and we know that COVID affects that. So we had that episode, but that's new information that I wanted to add. We talked about sleep, another number one question. How many of us can't sleep? And it could be from body pain. So we had a pain episode to talk about arthritis. workout pain, recovery, emotional pain, depression, and anxiety. And these were in 3 separate episodes that we covered, but these were your questions. Hey, I'm anxious. Again, this has been a very anxious year. And so this has been a wonderful year for us to offer something that gives a protection to people during this hard time. One of the things that I do want to say that we've mentioned briefly under our pain is that at our office, we do have a pain management program. And this pain management program is very important because it's complementary. It's not just CBD. We have other alternative medicines, and we collaborate with doctors. Our program manager, Veronica Galindo. Hi, Veronica, if you're there watching. She's also a registered nurse, a CBD consultant, and she's spearheading the pain management along with me. And it's very successful and it's integrative. So don't do it alone.
Dr. Kat, I just wanted to clarify something. You said complementary, meaning you marry together different pain management, right? Like, I just wanted a little bit of a clarification.
Here's another great question. So maybe we didn't touch this one on the highlights, or maybe we did because there's so much. But complementary means along and besides married. It's not the treatment. So for example, we had a cancer episode and we talked about my story and how I use CBD complementary. I did not do the surgery. I did not do the chemo. I used the CBD in complement of the medicines to help with the side effects that the medicines create.
So in conjunction with, basically.
In conjunction. Now, it can be used as an alternative. It means a lot of people come in for depression and anxiety, and they don't want to use a medicine, or for opiates. We use it as an alternative, or to get people off of opiates. And we had that episode on opiates, and we talked about, how it's affected the world, our country. And there's so much good research coming out. And the research already, as we talked about, you can listen to the program, is very promising. So alternative or complementary, and integrative means like this with other natural health and conventional medicines. So we also had, we had Angel, who's my little 2.5-pound Chihuahua, who joined us. And she was so good. And we talked about pet care. And I have some things to show you about pets, especially during holidays. There's going to be a lot of maybe family. Hopefully people are sheltering in place with their family. But we've been doing a lot of pet care with the holidays, 4th of July, January 1st, our pets get scared from the noise, but there are pets who have abandonment issues, or when you leave the home, but everybody's home now.
Right.
And then we talked about very briefly, and I wish we had more time, about CBD and our gut health and how it affects, and we've talked about skin, and this was in the skin episode, how when our gut is healthy, our skin is healthy, and dermatitis, eczema is connected to our gut health, and how it helps with GERD. And not only that, there's bacteria in the stomach and issues around our endocannabinoid systems in our stomach that affect us from losing weight, and we can actually gain weight, especially around our stomach, and how CBD is helping that. And at our weight management program at our center, it's a complementary, so we can see where CBD is not the only thing, but part of so many other things that helps make us complete, because that's what CBD does. And we talked about CBD, our endocannabinoid system, and how that is the largest receptor in our entire body to bring us back into homeostasis, which means in balance. And I feel like, I don't want to use fountain of youth, but when you think about the words, bringing yourself back in balance, when you're not exercising and you're exercise, what happens to your body? It looks healthier, and healthier is youthful. If you bring your endocannabinoid back in, you're going to be more youthful. You're going to feel better. You'll be happier. And of course, we talked about anxiety, depression, PTSD for CBD. And most of all, using CBD protectively. I use it every day because I know it protects me. The research is promising around cancer. And I see it in the future. And we have people who use it every day like a vitamin preventatively. So that's, did I miss anything? I mean, we had a lot of things. I was
Yes.
going fast because we're nuggets.
That was great. Thank you. I think it's also really important to remind everyone, hemp CBD is not a cure-all. We've never stated that. We don't make that, as part of our educational information that we disseminate. We want to be very clear about that. And also, we want to remind everyone that everybody's the way that they receive hemp CBD, the way that it works, it's different for everybody, which is why we have the CBD experts like yourself, a CBD therapist. Can you just really quickly, I know you're excited to get to the special announcements, but can you talk about a little bit about how, because everyone's different, why it's important to talk to your CBD educator, your CBD advocate, your CBD therapist like yourself?
Carmen, that's so important, because one of the things that we know about CBD is that everybody's endocannabinoid system is different. I talked about the glass being full or empty, and depending on genetics. And so I always say, go start low and go slow. And your consultant can help you with that. You can buy CBD and start slow on your own, but when you're coming in because there's something bothering you, hurting you, you're trying to get off of a medicine or avoid, a medication because you want to try something natural, it's best to work with a consultant who can educate you. Again, Veronica Galindo, she is our medical nurse CBD consultant, and so is Michelle Widener at the office, and myself. I'm a CBD clinician and CBD therapist and educator. We're all here to help you at Insight for Wellness. And not only that, we vet our products, and that's why I have some products to show, because they meet the criteria that we've been talking about. Because if you go online, you're going to get confused. There's some really good marketing ploys out there.
Like with everything else. Exactly. Yeah, exactly. Well, that I think was a perfect segue. I'm excited to see what the products that you're going to share with everyone, if you don't mind.
Absolutely. And we'll go into the samples because you'll need a code. So hang on till the end.
Okay.
They're small and there's just a few, but there's a new product that just came out, and I've been testing it for a month with my husband. My husband never sleeps. He's got restless legs. Sorry, Sid. I'm telling everyone, but I don't think it's a secret. And he's not my patient, so I know anybody here. But I've noticed that he's sleeping through the night, which is something he has never done. And I myself, have been using CBD to help relax, but I've tried this and it's new. We just started carrying it. It's Pocha Mama. And it is kava and valerian and 750 milligrams of CBD, and they're all organic. I absolutely love this. And I'm offering a discount for this at 10% off. If you call our number, 925-216-3510, and then we'll have it at the end also. Katie, who's at the office, Veronica, Katie will get these out to you, but you have to mention Dr.Kat, CBD with your favorite PhD, 10% discount off of this. This is a must-have. I think people, if they can't sleep, they need to try it. We know a lot about kava and valerian. It doesn't taste the best, FYI, but if you make valerian tea and you need it for sleep, and kava, you know that this is a very natural taste. The other products that we have here are the gummies. Charlotte's Web, which is one of the original hemp because of Charlotte, who had epilepsy, has a line of products that meets our criteria. The gummies have been very popular. And the gummies, there's recovery for the gym. They're very easy to take. They're natural. There's sleep, which is our most popular, and calm. I like the calm for during the day. There are little episodes that can make you nervous. I pop one in my mouth. It tastes good. And then we have by Charlotte's Web, Pet CBD. And we have different ones, so I won't, hold that one up too long. But again, we have pet shoes as well. And Veronica, who has beautiful dogs. You've probably seen pictures of her dogs. She's in an area where there's a lot of pet lovers near the country. And so we have a lot of people who've seen the value of that. We're offering those for $39.99. They're usually $44, and we are going to pay the tax on that. So get your gummies. Of course, my favorite serum that everybody knows. I shake it up. I put it on my neck. I'm like this all the time, and it's so easy. To get it on my fingers. It's great on the knees and in between the toes for arthritis. This is 50% off. Now we are short of supply. We're running out. I have to say we only have 3 left.
Okay. So, we'll have to do something about that.
Well, we will, but it's back ordered, right, Carmen? Just a little bit.
Yes.
But regardless, we're offering these up to December 24th. So even though we have 3 left, we're going to honor that, right?
Well, absolutely. And, it is handcrafted, small batch. So it's very, when you get it, it's that last batch. I always make sure that you get the fresh.
Absolutely. And that's what I love about it because, again, know your source. The other products that we have are ECS, endocannabinoid system. These are one of our most popular products because you cannot buy these except from your healthcare professional. You will not find these online or on Amazon. If you do, it's not the product, or they're not supposed to be selling them, not even in dispensaries. And we use these for our consultations because they have measuring dosages on them. Again, it meets all the criteria that we've been talking about. Then the other product that is new that you've heard me talking about is the Aspen Green. There's 10% off on the ECS, and Aspen Green, we have 20% off. If you go onto our website, insightforwellness.com, shop CBD, the first link, you click it, follow it, and you'll see all the products. And the code for your coupon is Dr.Kat, and they'll give you automatically 20% discount on your shopping cart. What I like about this organic product from Colorado, and again, we've talked about Colorado, CBD, is they have a variety. They have an oil spray. You can cover your whole body with it. They have all the way 500, 1,000, 2,000, and 3,000 doses. I haven't seen the 1,000, 2,000, and 3,000. Usually you see 500, 1,000, 3,000. So it gives you a little bit more variety. Somebody showed me their CBD recently and it was clear. And they said, I bought this for $16.99. I said, let me look at it. And it looked like water. And I was very upset because they were using it. And it probably may have some arnica in it or magnesium, which will give you the sense of pain relief. But it's not going to give you that anti-inflammatory that the CBD. The other thing that this company makes, Aspen Green, is several balms. They have one with mint for pain, 1,000 milligrams. They have one without the mint. And then they have a balm that's for the body. It's a body butter. And I actually, along with Bourbon, use it on my face. I don't know if I'm supposed to, but I saw the ingredients on the back because you can remember another criteria, know your ingredients. If you can read the ingredients and you know what's in there, then you're safe. And your product you can eat. If you can't eat the products.
You can't eat the product.
Don't put it on your face.
Right. Well, all the ingredients in Bourbon are food grade, meaning, again, that if you were to apply them in a different application and a different process, that they are ingestible, but not in the formula itself.
Yes, don't drink the formula, but my skin drinks it,
right?
Which I love it. Okay, are we ready for? Okay, and all of that. Again, when you call the office, Veronica will send you over to Katie, or Katie answers the phone. We have several people, but Katie's been helping with these specials so that we've assigned somebody because we're busy and it's holiday time, so we want to get you straight through.
I have the website and your code right there. If that's, I think, insightforwellness.com.
Yes, and go shop Dr.Kat, and that's for the Aspen Green. You have to call in for all the other products because we want to personalize the call, make sure we ship it to you. You can come into the office, but we're shipping right now, and we're doing telehealth consultations. This is amazing because we can see each other so close, and in each other's home. And we can't do that these days.
Right.
ECS, absolute best topical. Patients love it and have excellent results. Yes, we do. And it comes in a 500 and in 1,000. I have people who golf. Right, Veronica? Back to golf. It's amazing. People who have neuropathy at the bottom of their feet. We never have enough time for these episodes. And
I know.
hopefully next year we can tell some stories. Sample time.
Okay.
So I have 3 samples, and it's for the first 3 people. The first one is a small, it's Charlotte's Web, and it is 17 milligrams of CBD for you to try. We will mail these to you in little mailers. And then the other one is an ECS 50 milligrams. Now, this is for pain because it's a high dose. And you would take this one at night, try it. And if you're hurting during the day and you find after 3 days that it's effective, if you're having trouble sleeping, you can try it. But this is also another one, and it's for the first 3 callers. That code is Dr.Kat CBD, your favorite PhD. You gotta say the whole thing.
You're not making this easy. What's the number for them to call? So you said the first 3 callers, right, will get one of those samples. Yes. They have to say the whole phrase.
Yes.
And the number is
925-216-3510.
Okay, great. Well, I think that pretty much wraps it up for this year, for 2020. It has definitely been a very interesting time in our lives, in all of our lives. We hope that these nuggets of information have opened up the possibilities for you for a new way to enhance your health with hemp CBD. Dr. Kat, I know that we've got some exciting new ideas and projects, both individually, possibly together. I'm really excited. What I would love for everyone to do is just continue to keep up with us on our Facebook pages, and we'll keep you posted with any of the new announcements coming up for 2021. Anything else, Dr. Kat?
Happy holidays.
Yes, happy holidays. Thank you for spending the majority of the year here with us on CBD with your favorite PhD. Our job here was to share with you some information regarding this plant, the whole plant, and nothing but the hemp CBD plant. That's our focus. All right, everyone. Thanks for tuning in, and we wish you the very best for the remainder of the year. Happy holidays, and we hope to see you in 2021. Thank you for joining us. Bye-bye. Bye, Dr. Kat.
Bye, Carmen.
Bye, everyone. Thank you.